If you're watching this video, it's probably because you have someone in your life, a parent, a spouse, someone you love, and you want to know what no one really tells you. Most people believe that if a surgeon recommends an operation, it must be the right choice. The doctor knows best. The hospital has the equipment. The paperwork is ready. You just have to sign. I used to believe that too, until the day I started counting the patients who came in for so-called routine procedures, and who came out transformed, not improved, transformed. And the most disturbing part is that many of these patients have been described as being in good shape for their age just a few days earlier. A man who came in with back pain left unable to walk. A woman who survived heart surgery but lost 6 months of her life in complications no one had warned her about. And here's what almost no one tells you. The older your body gets, the harder it struggles just to survive the operation itself. Not the disease, the operation. In a few minutes, I'm going to reveal the surgery that some surgeons fear themselves in elderly patients. Because after 60, the greatest danger is sometimes not the operation people think. After this video, you will probably never look at a surgical recommendation the same way again. I am Dr. Health Tosh, and today, I'm going to tell you the truth about 5 surgeries that carry especially serious hidden risks after age 60. And at the end of this video, I will give you the 4 exact questions you can ask any surgeon. Questions that can literally change a medical decision. But first, one number, 40%. 40% of adults over 75 show signs of medical frailty. Age is not the real problem. Frailty is. And many patients discover that difference too late. Coronary bypass surgery can save lives. But in a frail 78-year-old patient with diabetes, kidney failure, or cognitive decline, the heart-lung machine sometimes acts like a massive assault on every organ in the body. Stroke, prolonged confusion, mechanical ventilation, kidney failure. But that is not even always the complication that terrifies families the most. Sometimes, the patient technically survives, but their personality, their memory, their independence never fully return. And here's the number that shocks many families. Up to 15% of high-risk elderly patients do not survive the first 30 days. What many people do not realize is that some patients discover these alternatives only after agreeing to major surgery. Today, some alternatives exist, like TAVI, less invasive, less traumatic, sometimes far better suited to an aging body. The question to ask your surgeon: am I a candidate for a less invasive option? You just saw how heart surgery can destroy a patient's memory and identity. The next surgery targets a different area, but the outcome can be just as brutal, and it is recommended 10 times more often. Most back pain after 60 is not life-threatening, but some major spinal surgeries can change a life forever. And sometimes, the real problem only begins after the operation, when the body tries to recover, but no longer has enough reserves to do it. Multiple fusions, metal rods, screws, complex decompressions. A study published in Spine revealed complication rates exceeding 40% in patients over 65 undergoing complex lumbar fusions. And in nearly 1 out of 5 cases, postoperative pain turns out to be comparable or even worse than before the procedure. Even more troubling, a meta-analysis published in JAMA concluded that for certain degenerative conditions, intensive physical therapy achieves results equivalent to surgery, without the surgical risks. 1 out of 4 patients undergoing back surgery after 65 never regain their preoperative level of independence. And here's what makes this psychologically brutal. Many had entered the hospital walking on their own. A spine surgeon once told me, the best operation is sometimes the one we decide not to do. The back, the heart, 2 different organs, the same underlying question. Will this operation truly improve life or simply prolong it in pain?